Today we have with us Dr. Leena Deshpande, developmental pediatrician. Her specialization deals with treating and diagnosing children with developmental delays. Today she's going to talk about cerebral palsy and the various conditions associated with it.
See, there are some children who have problems primarily in their motor development. So they might have delayed head control. They may sit late or not be able to sit at all for a very long time. They might not be able to stand or bear weight on their feet. These children might have very stiff muscles or very loose muscles. They have very poor control over their motor movements or muscle movements. This usually happens if there has been some sort of an insult or injury to the developing brain. So it could have happened before birth, during birth, or after birth. This injury to the brain causes a disability in the child which can be or which is usually lifelong.
So is cerebral palsy only a problem with physical skills?
No, it can be associated with various other problems in the child, like global developmental delay. So developmental delay in more than one area, it's not just the physical skills. The child might be delayed in his speech and language skills. The child might be delayed in his cognitive or thinking ability. There might be other problems like vision impairment or hearing problems in the child, or the child might have other neurological conditions like seizures or convulsions associated with this condition. So the child has to be comprehensively assessed to look for these problems. Depending on where the injury has happened in the brain, different parts of body get affected or different muscle groups get affected. Suppose one half of the body is affected, we call it hemiplegic cerebral palsy. If the child's both legs are being affected, it's diplegic cerebral palsy. And if all four limbs are affected, then it is quadriplegic cerebral palsy. We can also classify cerebral palsy in different types depending on whether the muscles are very tight or very loose. So it can be a spastic cerebral palsy or hypotonic cerebral palsy. The most important classification of type of cerebral palsy depends on the functional classification, depending on what the child is able to do, whether it is mildly affected, whether the child is mildly affected, moderately or severely affected.
And what kind of tests help diagnose cerebral palsy?
Tests are usually done to look for associated problems. For example, hearing assessment, vision assessment. We might order an EEG if the child is having convulsions. We might order an MRI scan of the brain to look exactly where the injury has happened, and we might get some idea about the extent of injury. So tests which we do in child with cerebral palsy are to look for associated conditions and not to diagnose cerebral palsy as such.
Now that we know what cerebral palsy is, what message would you like to give the parents?
I think the first most important message is that the parents have to be aware of this condition, especially in children who are in the high risk category. Children who have had to spend time in the intensive care after their birth because of any problems at birth. The child might have been premature, the child might have been low birth weight, there might have been high jaundice in the child, infections or any other conditions like low blood sugar. If the child has had to spend time in intensive care unit after birth, these children are at a higher risk for neurodevelopmental problems. So these children have to be monitored very closely by specialists and looked and signs and symptoms to pick up early signs of cerebral palsy have to be looked for. The reason for this is early pickup will lead to early intervention, will lead to better outcome in the future.
After a child is diagnosed with cerebral palsy, what kind of treatment options does the child have?
The mainstay of treatment remains physiotherapy, which is what we call as neurodevelopmental therapy in children. The earlier we start it, again the brain starts reorganizing itself depending on the kind of therapy you do. Depending on what other conditions the child had, the child will need multidisciplinary approach in the form of occupational therapy, speech and language therapy, and later on maybe it's a special educator. If the child has problems like epilepsy, that needs to be treated. Hearing and vision problems need to be diagnosed early and treated. We have medications and certain injections which can be used to reduce the stiffness of the muscles, but these have to be used in conjunction with physiotherapy and after proper patient selection.
Do children with cerebral palsy get better?
Better, yes. Cured, no. It all depends on what kind of cerebral palsy the child has. It all depends on how severe the affliction is. It also depends on what other medical conditions the child has along with. It depends on how early the child has been picked up, and it definitely depends on how motivated the family and the child is to carry on regular physiotherapy and various therapies and inputs which have been given by various disciplinaries.
Found our information useful? If you find the video helped you, please like it. Tell us what you think about our videos. Please leave a comment. To watch our other videos, click here. For more on your health, log on to health.india.com.